Welcome back. In this video, I will discuss infectious mononucleosis. Infectious mononucleosis is caused by Epstein-Barr virus. So, infectious mononucleosis is caused by Epstein-Barr virus (EBV), and this infection transmits mainly through saliva. So, it is also known as kissing disease. Also, it can be shared through utensils. For example, a person drinks a glass of water and he is infected with this EBV, then it can be transmitted to the other person. Here you can see it is a kissing disease. Saliva is the main way of transmission. Pathophysiology. First, Epstein-Barr virus infects B lymphocytes. When B lymphocytes are infected, they lead to proliferation of the cytotoxic T lymphocytes. Cytotoxic T lymphocytes also appear in the peripheral smear as atypical lymphocytes, and they cause lymphoid tissue hyperplasia. Therefore, there is generalized lymphadenopathy in case of infectious mononucleosis. Here you can see Epstein-Barr virus infects B lymphocytes. B lymphocytes cause proliferation of cytotoxic T lymphocytes, leading to lymphoid tissue hyperplasia. Clinical presentation. Patient presents like if he or she has sore throat, pharyngitis. It is often severe and may mimic streptococcal infection, streptococcal pharyngitis. But in this disease, you when give amoxicillin, then it leads to maculopapular rash all over the body. So it leads to development of rash when you give amoxicillin in case of Epstein-Barr virus infectious mononucleosis. Patient may also have marked fatigue, and this fatigue can last for weeks. Malaise, headache, and myalgia as with other illnesses. But signs are very important because patient has generalized lymphadenopathy. Tonsillar enlargement with exudates can be seen. Splenomegaly. The spleen is enlarged in size, and therefore there is chance of rupture of spleen when you play contact sports. Hepatomegaly. Palatal petechia. This is very typical of infectious mononucleosis. On examination of the oral cavity, you will see palatal petechia. Occasionally, patient has jaundice, periorbital edema, rash, especially after given ampicillin or amoxicillin, as I have told you. So, sore throat fever, fatigue, symptoms, these are the main symptoms. Diagnosis. First one, you will do CBC. You will see there is lymphocytosis, and on peripheral smear you will see these are atypical lymphocytes. Then you go for a typical diagnostic test, Monospot test, in which there is positive heterophile antibody. So it is positive in most cases after 1 week of the symptoms. You should perform it after 1 week of symptoms. EBV specific antibodies can also be done like VCA IgM. It indicates acute infection. IgG shows past infection. Then other antibody tests can be done. Liver function tests are important because it also causes mild hepatitis, elevation in AST and ALT. How will you manage this condition? It is a viral infection and requires general or supportive care. That is rest and maintain adequate hydration. Number 1, rest, and number 2, adequate hydration. Sometimes patients require analgesia and antipyretics for paracetamol, for example, paracetamol or ibuprofen for pain and fever. I have told you that avoid contact sports for at least 4 weeks because if you go for contact sports like rugby, it leads to splenic rupture. So to prevent this, avoid contact sports. So there is risk of rupture of spleen. So avoid contact sports like here shown rugby. So this is all about infectious mononucleosis.